thank you very much for joining us, and we hope that it will be a valuable experience for you. So, firstly, we are Sarah Baker and Denise Mathams. So I'll introduce myself first. So I'm Denise Mathams. I've got a paediatric nursing, children's nursing background. I've worked both at clinical level and in leadership roles across the hospital, usually the NHS and charitable sector. And I'm delighted to be here today.
Okay.
So I'm one half of Speak Up, Be Heard.
Trying.
Are you okay there? Yeah. Next
If
slide.
people could mute, that would be good. Thank you.
Thank you. Sarah, next slide, please. So, Sarah, I didn't know if you wanted to say something about yourself and...
So yes, hello everybody. I'm Sarah Baker. I'm the other half of Speak Up Be Heard. Like Denise, I'm a children's nurse. I'm also a health visitor, and I've had over 40 years experience in the NHS, both at a clinical and leadership level, working mainly in community organisations. I've also worked in the charity sector as a trustee, and it was there that I held a Freedom to Speak Up lead, board lead, which really sparked my interest in the freedom to speak up. Thank you, Denise.
So, Sarah and I met as trustees at a charitable organisation, children's charitable organisation in Surrey, and it was about the time when there was quite a lot of media coverage around the difficulties that and the barriers to freedom to speak up, and we were driven, having those sort of common kind of thoughts about freedom to speak up, and we very much driven to make that difference. At the time, there was clear media coverage, and it was largely about where freedom to speak up hadn't perhaps worked as well as it could have done, and whether that was a confidence thing within an organisation. There's lots of different reasons. Some cultural barriers, so not having that culture of people being enabled and comfortable to speak up, and some obvious, genuine misunderstandings. But we also recognise that these have impacted both on patients and staff. So on patients adversely, and on staff's well-being itself. And we recognise very much the need to speak up to protect the well-being of families served by the children's hospice sector. So we completely realise and understand the vulnerabilities really of the families that you serve in the children's hospice sector, but equally how very difficult it can sometimes be to raise your voice in what are often very small and quite unique organisations. And that's what sort of struck us a little bit, really, is and for that reason we tend to work with the smaller organisations like hospices and with smaller charitable organisations and the private sector. And so why is it that freedom to speak up is so important? Well, thinking back and going back to 2018, when the Francis report was published, this sent some shockwaves around the country about the ability for how people felt about having the tools to be able to speak up and the cultures within the different organisations. And largely that was centred around NHS organisations, and certainly the report itself was centred around the mid-staffs situation, which I'm sure a lot of you will be aware of. But it's important also because it impacts not only on the quality of patient care, but patient safety, and can over time. So it's a little bit like safeguarding, I always think. There's little bits of the puzzle which suddenly start to make a bigger difference. So a small improvement may not have a huge impact to start with, but put it together with other people's views, and suddenly you have a much deeper understanding about where improvements can be made. Clearly, where patient safety is concerned, you would want to be in a position where you can impact positively that experience that patients have, and always able to determine that best practice. And aside to patient safety and best practice, we also have to be aware of the need to be clear on staff safety, and that's very safe working environment, because that working environment is equally the environment which the families, of course, come to you and live in. So it's important to do that. It's about having that culture that enables and facilitates staff to feel free to speak up about anything they feel is important to influence. And that influence is and that influence is all important in terms of the getting that safe patient environment and the working environment for staff members as well. But anything that has the impact has the potential really to impact, as I said earlier, is always worth raising, because that small thing that's concerning you might well be that last piece of the puzzle that makes it something that that managers or people within your organisation will want to take forward. So just moving forward and looking at the relevance. There's a clear connection between freedom to speak up, safeguarding complaints, and the new patient safety response framework and reviews framework, and all are about important those are, and the triangulation of all of those different aspects are so important in making that huge difference that can be made to patient care and patient safety. We know that it's broader now than whistleblowing. It's about having that voice to improve. There doesn't have to be anything tangibly wrong, just that small improvement, which could go on to be a larger improvement as people contribute. So creating that freedom to speak up culture is key to making improvements everyone's business. And again, it's about once you start building that culture, it suddenly becomes the norm. And the norm in a smallish organisation is really important to determine quite quickly. And no one should feel that their voice can't be heard, or that their role is isn't important enough. And we'll talk about the different areas of work within children's hospices as we walk through the presentation. But recognising the vulnerability of the child and family group always has to be at the heart of freedom to speak up, as it is with any of the connecting areas, such as safeguarding complaints and review of safety incidents. So Sarah, if you can move on. So making it work in the sector, there are lots of different applicable models, and each organisation will have chosen their organisational model depending firstly on what their journey has been, and whether they have actually been involved in setting up freedom to speak up services in the past. So one would be an in-house guardian, and I'm sure some of you will have had experience of this either in the NHS or in the hospice sector. There are other models where independent guardians with in-house champions and ambassadors, and that's the kind of model that Sarah and I particularly enjoy working with. And there's another model where external independent guardians become the fully independent, and the organisation really just works to them rather than getting involved in the cultural side of things themselves. So there's lots and lots of different models, and it really does depend on what the organisation's journey's been. I can't stress enough the importance, though, of board involvement, and now certainly there is an expectation that there would either be a trustee or a non-executive director in the NHS that holds that role and holds the board to account really on understanding and considering the benefits of freedom to speak up. There has to be that clinical and people team involvement, and each have got an extremely important role to advocate for families and for bringing the cultural benefits of freedom to speak up to life. There's also that important area of policy development. And I think it's really important to understand that policies are written with the best interest of freedom to speak up as it is at that moment in time. But things change, and there is little doubt that that policy will need to be reviewed in your organisations on a very regular basis. And I'm sure you've seen that within your organisations. So moving on, so the breadth of the sector. Well, we recognise just how huge it is really in these small organisations have an absolute breadth of people that are contributing to the care that the children get, whether that be clinical, whether that be through sort of the nursing teams, the care teams, the medical teams, all of whom contribute, the therapists. And if you think about play and recreation, the amount of time that they spend with the families themselves, and you know, their role as advocates for those families. Finance, you know, the finance teams are advocates for charitable and national money, and so they absolutely have the responsibility to make sure that that stewardship really of the money that is being spent for the children and families, and that it's being well resourced. Leadership clearly within the children's hospice sector is vitally important, and you would expect that at the beginning of the journey and throughout the journey of freedom to speak up, that leaderships within hospice sector display the behaviours that you would expect, i.e. really embedding that culture of open discussion. Estates and facilities, well, clearly they have a role to play in, firstly, in the safety of the environment, but equally in understanding, you know, what improvements could be made. So, for example, if in one area there appears to be an open-armed approach to making a development and perhaps not in another, they have an important role in that, in advocating for the best possible facilities and the best safest facilities for the children, families, and for the staff themselves. Voluntary services, again, often get potentially forgotten, but they should absolutely have a voice in making sure that they are able to contribute really to the understanding of improvement. Temporary staffing is extremely important, and it's something that that's become more of an issue perhaps in the NHS in recent times, potentially because of the amount of turnover of temporary staffing, and making sure that they are able to contribute to that improvement journey. And another area, of course, and linked in a way to finance, would be sort of fundraising and making sure that that every potential benefit for fundraising is considered, so that the staff and the families served enjoy the best possible environment for their families. So moving on to the role of the guardian. So the aim really is to grow the culture of speaking up, and really to support staff in providing that confidential and independent route for staff to speak up when they feel they can't in other ways. Sometimes that's a mistaken presumption that they can't in other ways, and they just need the guidance that helps them to find the right route. But other times they absolutely feel concerned about raising their voice, and it's the role of the guardian to support staff through that. Ensuring that the issues that have been raised are responded to, and that person speaking up receives, firstly, and absolutely a thanked for raising their concerns, but that they receive feedback on the actions that are taken, that they address, the guardian addresses the barriers and works very proactively with the organisation to tackle cultural and structural barriers, and to advise really on how that can be achieved, and how that culture can be embedded within the organisation. So promoting learning, using matters raised for opportunities for organisation and learning and improvement. And this will resonate with some of you when you think about, the triangulation that we talked about earlier, and how staff can use those opportunities really to learn for improvement, and how those other areas such as safeguarding, patient safety, investigations, etc., can also triangulate to give additional resources into that improvement journey. Escalating issues and helping to identify appropriate contacts and escalation for routes for support are obviously still very important too. As the next slide, thank you. I'm getting that independent challenge. So Guardian's got a key function really in providing a layer of supportive but equally independent challenge to the senior leadership team regarding that organisational speaking up culture, and to really challenge the views of the organisation in really going to that next step in cultural embeddedness within the organisation, and building trust by being visible and accessible, and making sure, so Sarah and I, for example, will make sure we go into the different organisations to make sure that they're visible and accessible, because although it's great to have team meetings and it's obviously a very practical way of going around things, there's nothing quite like those face-to-face conversations that you can have with staff members, and that helps to build the trust and confidence in that speaking up process. Ensuring safety, they can certainly, Guardians help to ensure the organisation feels safe and transparent place to work, where staff feel absolutely comfortable and that it's seen as the normal practice in raising concerns. So thank you. And how champions build that resilience. And champions can be called different things in different organisations. Some will say champions, advocates, or ambassadors. Others will just call them team members or freedom to speak up, link workers, lots of different terms used right the way across the health sector. But they're absolutely key, really, in developing that culture on a day-to-day basis. So they bring those conversations to life in a way that the Guardians would find it difficult. So in their normal practice, they can bring it to life. And hugely valuable in signposted, and always best really to consider that internal resolution first. And certainly it would always be a question the Guardians would make about whether there has been a process that people have gone through in order to get their voice heard, or if they have jumped straight to the role of the Guardian. But one of the most important things, I think, in champions and building that resilience is to add to the thinking of the Freedom to Speak Up team. And I always believe that individuals are great, but there's nothing quite like a team. Everyone contributes, and no one person can get it all right. So get a team around it and suddenly you're in a different position. But that communication across the organisation and making sure, as I said right at the beginning, is developing that culture of speaking up and making it the normal thing to do. So the next slide describes the National Guardian Office, and some of you might have been hearing some of the things that have been changing in health services, and certainly NHS England, as we recognise it today, is going to change from April, and will no longer be used in the same way. But the National Guardian Office, as one of the national offices, is no longer going to exist, and so we're waiting to hear at the moment exactly what that's going to look like for the future. But it's unlikely after April of 2026 that it will exist at all. And it's likely that that Guardians will be supported, therefore, but by a different function. But at the moment, the National Guardian Office has a really important role to play, and that will be taken on by whoever therefore takes on that function. The guardians now need to be registered with the National Guardian Office, and that is provided once the guardian has undertaken a significant amount of training and development. They continue to have a supporting network of and coaching for guardians throughout the period of their employment at different organisations. The guardians also have the role to play in reporting data on a quarterly basis. So all of your organisations will be reporting through the National Guardian Office at the moment. There are a number of regional meetings which Sarah and I go to, and your own guardians will be likely to be going to. There are a significant amount of resources available, and the networking opportunities are really quite huge. So we're hoping that going forward that will all be protected, all within a different guise. Thank you. So next slide. The CQC expectations, which obviously are hugely important. So guardians are currently consulting with or the CQC are actually consulting with guardians about the inspection framework. But what we do know is that Freedom to Speak Up will continue to be inspected under the well-led domain and is likely to play a more dominant role in the safe domain. So there's certainly a view that that it's much more than just having guardians and champions. It's much more about, and so you've had this in place for some time now, and how has that changed your cultural understanding about freedom to speak up, and how is it changing the data that you're able to report on a quarterly basis? So it's about the organisation being able to demonstrate that culture of freedom to speak up in a way that really is able to identify the improvements that have been made throughout by having those voices heard. Thank you, Sarah. So we've got a number of discussion points, but we would obviously really like you to contribute to. Some of those are things about what are the barriers within the sector, within the children's hospice sector, and what have you found that really makes a difference? And what different models have you found particularly helpful? What about the advocacy role in terms of the vulnerability of the families? And how about the non-clinical aspects of freedom to speak up? The things that we talked about during the presentation, how each of the different departments within a very small organisation, such as the children's hospices that you all work with, how they all impact on that ability to speak up and to make improvements. So thank you for listening to the presentation. You'll clearly all have your own organisational arrangements in place, and so of course it's not our role to understand to caseload your organisational freedom to speak up cases. That's for your guardian, but our contact is up there if there was anything that we could help with in terms of navigating a system, or if you wanted to contact us if we could help with your guardian work if you haven't already got a guardian in place. So that's our email.